Hey everybody, Dr. Kristen here with Every Family Chiropractic Center. So, what am I going to talk about today? Well, I'm going to talk about chiropractic and Down syndrome and how it can help those that have Down syndrome. I go with a little bit of background on chiropractic because there may be some people who are watching this video who aren't too familiar with it. So, if you are not very familiar with chiropractic, the three main reasons or three categories that I would put people in for why they come to the chiropractor are these. So the most common that people know about are people coming in to see the chiropractor for pain-related issues. So that could be neck pain, back pain, migraines, the things people normally associate with chiropractic. And then there are those that come in for major medical conditions. So that could be anything from anxiety, bedwetting, seizures, digestive issues, anything you can think of really. And these are the things that people don't necessarily associate with chiropractic, but that chiropractic can definitely help with. And then we've got people who come in for preventative or wellness care. They use chiropractic as part of their whole healthcare routine to keep themselves staying well, feeling good. Now, how is it that chiropractic is actually able to help all these people? Well, I am going to tell you. Alrighty, so I want to backtrack a little here and talk about some of the different organs in the body. So we've got our heart. Everyone understands why our heart is important. It pumps blood through the body. It supplies us with oxygen and nutrients to the tissues. Our intestines here, that's going to absorb a lot of the nutrients and water that we put into our body. Then, of course, we've got our lungs, and our lungs are responsible for respiration. Oxygen enters the blood, CO2 leaves the blood, all very vital, important organs. However, what is the most important organ? Well, it's our brain, because our brain tells everything how to work. So, again, how does that correlate to chiropractic? Well, in chiropractic, we have something that we call the communication highway. At least we call it that here at the office. Our communication highway consists of your brain and your spinal cord and all of the nerves that communicate to everything in your body. Ideally, you want to have a clear nervous system so that everything functions properly and it functions with ease, and therefore you have good health. However, we have what we call the 3 T's. So the 3 T's are thoughts, traumas, and toxins. And these are things that can cause subluxation within the spine. So thoughts could be stress, anxiety, trauma, physical trauma, something a lot of people can already understand affects your spine negatively. And then toxins. So this is anything that you put in or on your body that is bad for you, can also create subluxation or interference within the nervous system, and then those nerves are not able to communicate to those organs as properly as it should. So when that happens, you no longer have a clear nervous system. You end up having dysfunction, dis-ease, and then bad health. So it is our goal as a chiropractor to make sure to go through and find those areas of subluxation, those areas where the nerves aren't communicating with the body well, and clear that up. So how does this relate to people who have Down syndrome? How does it relate to mom or dad out there? How is it going to affect your child with Down syndrome? Well, the things that I'm going to talk about primarily, I've listed here. Is it safe when ligament laxity is present to get adjusted? How does this affect the immune system? How will it affect digestive issues? How will it affect heart defects? Will it affect my child's mood? And how will it affect development? These are all the things that I'm going to go through because these are usually what we end up being asked the most by our parents of kids with Down syndrome. So I am going to talk about the technique that we do here at the office. So it's called Koren Specific Technique. KST is what we call it. It's a very safe, very light force technique, and it's used at a frequency that is just below the pain threshold. So you can see we've got photos here of little kids getting adjusted. They actually enjoy it. Sometimes they laugh because they think that it tickles. So it's a very safe, very light force technique, because I know that a lot of parents of kids with Down syndrome, sometimes they get concerned because one of the issues is ligament laxity. And especially with the atlas and the axis, the first two bones up in the neck, there's instability that's very commonly present with that. And the nice thing about this instrument is that it's not going to make that worse. If anything, when we adjust, what we're trying to do is help that atlantoaxial instability from getting worse. And in addition, we're helping to alleviate some of the symptoms that could be present with that instability. So you don't have to worry that this instrument is going to make any type of ligament laxity or instability worse. It's actually going to do some good. And then moving on, how does it affect my child's immunity? Well, when we're adjusting, we're not necessarily adjusting for one specific condition. We don't go in and say, well, this is the immune system adjustment, or this is the digestive system adjustment. We let the body tell us what to do, and we go through and find where they are having issues within the nervous system. When immunity is affected the most, though, is when the vagus nerve is triggered, or we allow that vagus nerve to talk to the body the way that it's supposed to. And the reason why, it's written here, is the vagus nerve is the major nerve involved with the inflammatory reflex. So that means that it controls your body's innate response to inflammation. So anything that comes into your body that causes inflammation, your vagus nerve is responsible for having that proper reaction to it to fight that off. And we all know inflammation is the big sickness, the big killer that's in our body. So that's a big part of how we affect immunity when we adjust, because we are allowing that vagus nerve, which originates at the base of the brainstem, to function the way that it's supposed to. And you'll notice, for people that are already patients, they know this, but for people that are not, a lot of our adjustments are actually done to the cranial bones and up in the top area of the neck and the occiput. And that's what really allows this vagus nerve to open up and function the way that it's supposed to. Oh, and I do have pictures of the cranial bones over here, so you can see that we do adjust these individual bones often. Moving on to emotional well-being. One of the other things we get asked about is, how are these adjustments going to help my child's emotions? And again, I am going to end up talking about the vagus nerve and its role that it plays in emotions. And the main reason that the vagus nerve has such an effect on emotional well-being is because the vagus nerve is a part of the parasympathetic nervous system. So it's a little difficult to see in this image here, but there are two different colors of nerves coming out of here. There's yellow and then there's green. So the green is vagus nerve. There's also some green that comes out at the bottom here as well. That parasympathetic nervous system is responsible for your rest and digest part of the body. And it allows us to react adequately to stressful situations, so to not overreact. It allows the body to calm down. So for kids who are a little too hyperactive or getting aggressive and upset, oftentimes an adjustment helps calm that nervous system down and calm down those emotions. So we even have patients who will jokingly come in and say that, their kid's been out of control, give them this adjustment. We know it's going to help calm them down. And it's really cool when we get to the point where patients can understand the effects that the adjustment can have on emotions as well, and just brain function, as well as the pain things that are going on in their body. So the next thing that I want to talk about is because this is a common thing, we often have kids who have Down syndrome will have some struggles with heart issues, and they'll have some struggles with digestive issues. And like I said previously, there's no one single spot that this is going to fix the digestive system, or one single spot where that's going to be what fixes the heart. There are, if you notice, many nerves that go out to the digestive system. So we still don't just go right to these nerves and adjust if somebody is having digestive issues. We let the body tell us where it's struggling the most. But I will say, oftentimes, when someone is struggling with a digestive problem, more often than not, the spots that we end up having to adjust correlate with the different vertebra that have nerves that go to those digestive organs. And occasionally, too, we will actually do adjustments away from the spine on the organs. And sometimes that helps a reset also to get things flowing the way that it's supposed to. And over here with the heart, once again, I am going to talk about the vagus nerve. And I'm sorry if you're getting bored of hearing about the vagus nerve, because it's just so important. And part of that is because of its ability to be a part of the parasympathetic nervous system and go to so many different organs in the body. And that's also why there are chiropractors out there who focus just on the neck, because they know just how much getting this vagus nerve to function properly is going to affect so many different areas of the body. And the vagus is the primary one that goes to the heart. So for kids with Down syndrome or adults with Down syndrome who are having digestive issues or heart issues, we can't sit here and promise you that we're going to fix all of it. But what we're going to do is allow those nerves to function as well as they are able to in their environment. So does that mean that they can improve? Yes. Does it mean they might stay the same and we're just stopping them from getting worse? It could also mean that. So last thing I just want to talk about is just how amazing the body is. We have a special way of communicating with the body when we adjust with our technique, with Koren Specific Technique, where we let the body tell us where to focus. So if somebody comes into us saying, my child has Down syndrome, what are you going to adjust to help with that? We don't have a specific formula for every single thing that someone comes in for. We don't have a sheet that says, well, this person's got this, and so this is the steps that we need to follow, and this is how we're going to fix this. That's not how it is. Our technique, we ask the body where you need to be adjusted. You know, we have several different ways of figuring out which joints are not moving well, therefore putting pressure on nerves, therefore not allowing proper function with the nervous system. And it's when we listen to the body, when we listen to our patients and adjust those areas, that we just slowly start to see the improvement with all the areas of difficulty, or we're helping keep them where they need to be, keep them stable. So for any person coming in, if it's their child who has Down syndrome, our primary goal is to have a positive impact on the overall wellness and reduce any type of complicating factors that can be going on. And of course, we like to make it a nice, positive environment. You know, I've talked to one of our parents recently about her child with Down syndrome who comes to our office, and I asked her what was most beneficial for her, about what she believes was most beneficial for her son coming in. And she said actually a huge part of it was bringing him into an atmosphere where he knows that we are doctors, and it is not a fearful atmosphere. We have so many kids in our office. We have fun jungle rooms for the kids to play in when they're getting adjusted. And that was a big thing for her, was to be able to have her son be in this space and know that it's a space of doctors, and have it be a stress-free environment, have to get rid of that fear, because then that helped when he had to go to other doctors' offices. And just even that interaction with us was beneficial for him as well. And of course, other things were definitely helped. I think probably one of the biggest ones we hear from our parents of Down syndrome is how it helps with the immune system and just helps keep them healthy. Because I know immunity is a big problem for that. So for anyone that does know someone with Down syndrome, knows a parent of someone with Down syndrome, and you ever want to get some more information from us, we would be happy to chat with you. And you can go ahead and you can call the office at 248-616-0900. You can email us. You go to our website, I think it's everychiropractic.com. It's terrible that my brain's not thinking properly to remember that. But you can also message us on Facebook here, and we'll make sure to get back to you. We would love to chat and consult and see how we can help you out. So I hope that this was informative. I hope that you all have a fantastic week and that you enjoyed the wonderful weather over the weekend. I will talk to you all next time.